Good afternoon, ladies and gentlemen. Thank you all for finding time and visiting today's Facebook Live talk. My name is Tracy and I am dietitian at Assunta Hospital. It's my pleasure to be the moderator of today. In this special occasion, we would like to have a talk about importance of health screening. Just a little housekeeping before we get started. If you have any questions during the talk, please type the questions into the comment box below the live video, and your questions will be answered during Q&A session at the end of the talk. Before the talk begins, I would like to introduce the presenter today, Dr. Alishna. Dr. Alishna graduated from International Medical University IMU in 2007. After completing her compulsory services in several government hospitals, she was largely involved in the field of primary care and health screening. Dr. Alishna is very passionate about the preventive healthcare as she is a true believer that prevention is always better than cure. All right, without further ado, let us welcome the presenter today, Dr. Alishna. Good afternoon, Dr. Alishna. The floor is yours.
Okay, thank you, Tracy, for your introduction. A very good afternoon, everyone. So I shall begin my talk for today entitled Importance of Health Screening. The definition of health screening by WHO would be identification of unrecognized disease or risk factors in an apparently healthy asymptomatic individual or population by means of various testing. Okay, this could be in the form of laboratory tests, example blood, urine, or pap smear testing, imaging tests, be it x-rays, ultrasound, mammogram, or various forms of cardiac testing such as resting ECG, echocardiogram, and so on. So there are three main levels of health prevention. My focus for today would be on primary and secondary prevention of disease. So primary prevention refers to health promotion, which includes health education, educating someone on the risk factors, identifying risks at the early stage, and taking relevant preventive measures. Okay, vaccination also comes under primary prevention. Secondary prevention refers to early diagnosis and prompt treatment, and the various screening tests done would actually come under secondary prevention. Okay, the topics that I will be briefly covering today are focusing on risk factors, prevalence, and the relevant screening tools available at present. Main one would be cardiovascular disease and risk factors, predominantly diabetes, hypertension, and high cholesterol, the various cancers, and also osteoporosis. Okay, so all these diseases come under non-communicable diseases, which is the leading cause of death worldwide. So I'll move on to my first topic for today, which is screening for cardiovascular disease and its risk factors. Okay, it's the leading cause of morbidity and mortality in our country and worldwide. So this shows the data in Malaysia, the disease burden in Malaysia in the year 2000. So as you can see, ranking top in the list would be coronary artery disease. Okay, further down, strokes and cancers rank about number 5. So the statistics is approximately the same today, cardiovascular or coronary artery disease being one of the leading cause of mortality. So what are the risk factors for cardiovascular disease? It's broadly divided into non-modifiable and modifiable risk. So age generally, as one ages, the risk tends to go up slightly. Gender, males tend to develop cardiovascular disease at an earlier age as compared to females. In Malaysia, being Indian puts you at a slightly increased risk, and a family history of premature heart disease also poses a risk. Modifiable risks would include diabetes, hypertension, high cholesterol, being overweight or obese, and overconsumption of alcohol, and even smoking. So what are the tools available in our clinical setting for screening? So generally, via a physical examination, we can come up with a BMI and categorize someone into either normal, being overweight or obese. relevant BP measurements to identify their BP readings accordingly. Blood screening, especially for diabetes, would be the fasting blood sugar, and someone who has deranged fasting blood sugar, we would then proceed to do a HbA1c or an oral glucose tolerance test. Okay, and for those people who already have diabetes, we would then need to monitor their sugar levels with the HbA1c. Cholesterol screening, including a fasting lipid profile, and the screening for coronary artery disease, predominantly a stress test, a stress echo, or in some centers, even a CT calcium score may be used for risk stratification. Okay, so the images below, on the far left, you can see a patient performing a stress test. The middle would be an echocardiogram, basically using ultrasound or sound waves to test the function of the heart. And on the far right would be an image of a calcified plaque in the blood vessels in the heart. Okay, so in order to take the relevant preventive measures, it's very important for us to stratify them according to low risk, moderate, and high risk categories. One of the very common tool used would be the Framingham risk scoring system. Okay, so this actually takes into account various parameters, including the age, gender, cholesterol levels, whether he or she is a smoker, diabetic, and blood pressure readings. So based on this tool, a person with a score of below 10% generally fall in the low risk category. Above 20% would be considered as high risk. Okay, what are the preventive measures that can be taken to prevent cardiovascular disease and its risk factors either before occurring or at early stages of diagnosis? Mainstay would be lifestyle modification, especially in those low risk to moderate risk categories. So diet control, generally a diet that is low in trans and saturated fat is encouraged. Avoidance of sugary beverages, diet rich in fiber and low in sodium. Okay, regular exercise is generally helpful to maintain cardiovascular health. So ideally, one is advised to exercise at least 150 minutes of moderate intensity per week. Okay, avoidance of other risk factors like alcohol and smoking, and weight reduction to uh, for those in obese and overweight levels. Okay, and if someone were to be diagnosed with other comorbidities like diabetes, hypertension, and when they are beyond a certain range, medications need to be advised accordingly. So I'll move on to my next topic for today, which is colorectal cancer. So colorectal cancer is actually the most commonest cancer among men today, second in women after breast cancer. Okay, most of these cancers are actually arising from adenomatous polyp. So the image on your right is a colonoscopy image of an adenomatous polyp. So a lot of people may have polyps, go undiagnosed, remain asymptomatic, so they are not detected until and when they present with symptoms or if they go for regular screenings. About two-thirds of these polyps may actually progress on to colorectal cancer in 10 to 20 years down the road. Okay, so it's important to screen those high-risk categories at an early stage, get these polyps removed and biopsied to reduce the risk of development of future cancer. So screening schedule is recommended according to age group. Okay, usually in those people with no risk factors, no symptoms, we generally recommend screening to start at the age of 50 years old, and earlier in those people who have high risk categories such as family history and so on. I'll be elaborating a bit on the risk factors on my next slide. Okay, the main screening tools available would be a fecal occult blood test and a colonoscopy. So what are the risk factors for colorectal cancer? So a family history of colorectal cancer in a first degree relative, certain individuals with inflammatory bowel disease are also at increased risk. Other lifestyle modifiable risk factors include a diet generally rich in red meat, processed meat is said to increase one's risk of cancer in the long run. Okay, sedentary lifestyle, alcohol and smoking may also contribute. So a lot of them in the early stage actually remain asymptomatic. Some may present with altered bowel habits, meaning alternating diarrhea and constipation, some with blood in the stools, some may present with anemic symptoms, and some may just go on to losing weight without any apparent symptoms. Okay, so we broadly classify them into risk stratify them accordingly: average, moderate, and the high risk categories. Okay, so for the average risk, as mentioned earlier, they are generally individuals above 50 years old with no apparent risk factors. Generally, a yearly fecal occult blood is recommended. If the fecal occult blood were to show any presence of blood, we would then advise to do a colonoscopy. Okay, for moderate risk categories, meaning with people with a positive family history of colorectal cancer, be it in the first degree, second degree, or third degree relatives, colonoscopy is indicated. So individuals with a family history of colorectal cancer below 60 years old, 3 to 5 year colonoscopy is generally advised. For those with family history of colorectal cancer above 60, colonoscopy at 10-year intervals is sufficient. Okay, and these individuals actually should start screening a little earlier compared to those average risk categories, ideally starting at about 40 years old. Okay, those high risk categories, meaning who has a family history, who suffered from colorectal cancer at a younger age, below 50, we may start screening them at 40 at intervals of 3 to 5 years once. And those high risk who actually have inherited colorectal cancer syndromes, these are certain high genetically predisposed cases, they would ideally be managed by the colorectal surgeons. So these are gross images of colonoscopy findings. On your far left is a colonoscopy of a polyp being removed at the same sitting and then biopsied subsequently. The middle would be an adenomatous polyp, and the far right would be a picture of a colorectal cancer itself. So I'll move on to the next cancer that's actually very rising in trend among women. Okay, it's the third most commonest cancer among women in Malaysia. The good thing about cervical cancer, we actually have a vaccination to prevent it. So all those people should start thinking about all ladies should start thinking about getting vaccinated at an early age. Okay, uh, highly recommended to get vaccinated before your sexually active years. Okay, the commonest risk for colorectal cancer would be the high risk HPV, human papilloma virus, especially type 16 and 18. Okay, main screening tools available: pap smear and also the HPV DNA testing. So a pap smear is actually to detect the cancerous and precancerous cells in the cervix. Okay, so again, when we detect early changes, relevant measures can be taken to prevent further progression. HPV DNA testing, as the name implies, would be to detect the high risk HPV on the surface of the cervix. Okay, this is a diagram from the 5th Malaysian Population and Family Survey done in the year 2014. So just to create some awareness, it was done in various states in Peninsular Malaysia. Less than half, 50% of women were actually going through this cervical cancer screening. Okay, so the reason being, they found that lack of health education being one of the commonest cause. Some women were shy to get tested, some having misconceptions that it's a very painful procedure, some because it's costly, so that limits testing. Some of them were having some of them were so that's about it, sorry. So I'll move on to my next slide. Okay, so what are the risk factors for cervical cancer? It would be high risk HPVs, as mentioned earlier, type 16 and type 18 predominantly. Other risk factors include those with pelvic inflammatory disease, sexually promiscuous women, women who had sexual intercourse at a very young age, below 18 years old, and those who have other immunodeficiency syndromes such as HIV are also at an increased risk. Other modifiable risk factors include uh, obesity and smoking. Okay, so again, a lot of them actually remain without symptoms. Some may complain of pain after sexual intercourse. Some may complain of postcoital bleeds, uh, bleeding in between their menstrual cycles, or even a bloody vaginal discharge. So just the gross image down here actually shows a normal cervix on your left and a diseased one on the right. Okay, so I did mention earlier the main forms of testing would be the pap smear. Some would just do just the pap smear alone, but in more recent years we tend to combine the pap smear with the HPV DNA test. Okay, intervals: start screening as soon as one becomes sexually active, so this can be 18, 20, or even older. Okay, at yearly intervals for the first 2 years, assuming the first two samples actually yielded normal results, we can then proceed to screen at 2 to 3 year intervals. So this is an image of a pap smear test. Okay, ideally a woman lies in a lithotomy position. We place the speculum into her vagina. Using a cyto brush, we get samples from the endocervical region. So it's important to get the samples from the right area. Then slide it on a glass slide and fix it with 95% alcohol. Is then subsequently sent to the lab for further testing. Okay, the next commonest cancer among women in Malaysia is breast cancer. Okay, a lot of them may remain without symptoms. Commonest presentation: some may complain of a breast lump, some may have changes in the skin over the breast, be it a rash, dimpling of the skin, inversion of the nipple, or even nipple discharge. Okay, what are the risk factors for breast cancer? Okay, the modifiable risk: first pregnancy at a later age, beyond 30 years old, puts someone at a higher risk. Prolonged use of oral contraceptive pills or hormone replacement therapy also increases one's risk. And other lifestyle modifiable risk factors such as obesity, sedentary lifestyle, smoking, and alcohol may contribute as well. Non-modifiable risk factors would include a family history of breast cancer, especially in a first degree relative. Another form would be a genetic mutations in the BRCA1 and 2 gene mutations. Okay, this BRCA gene is closely linked to the development of breast cancer as well as ovarian cancer. Okay, other risk factors would include early menarche below the ages of 12 and late menopause beyond 55 years old, history of radiation to the chest for lymphoma, for example, at a very young age, and those women with dense breasts tend to be at higher risk as well. So the screening tool, the main screening tool for breast cancer would be a mammogram. Okay, we do advise self breast examination, clinical breast examination, as well as clinical usually above 35 years old. Okay, so this is just an image showing an ultrasound image of a lesion, a benign lesion, non-cancerous lesion, and the picture on your left would be a mammogram of a cancer detected. Okay, so I'll be going on to explain who should get a mammogram done and so on in my next slide. So an average risk person, or rather a person with no strong family history, no personal history of breast cancer, it's a must to get. It's highly recommended to start screening at 50. You may also want to start a little earlier at the age of 40. Generally, screening at intervals of every 2 years with a mammogram is recommended. Okay, for those moderate risk group, it's definitely advised to start as early as 40 years old. Okay, for those high risk categories, such as those with a personal history of breast cancer, so maybe she had removed another breast, so now she has to go for regular yearly mammograms of the normal breast. Okay, for very strong family history of breast cancer or a mutated form of BRCA1 and 2 gene inheritance, you may want to even advise screening at an earlier age. So generally, even these individuals may even be advised to screen at the age of 30, and usually the mode used would be MRI of a breast. Okay, so generally speaking, some people may still require a supplemental breast ultrasound in addition, especially if their breast tissue remains dense on the mammogram. Okay, and in some cases, if the mammogram did show some abnormality, they may still need to do an ultrasound as well. Okay, my next topic for today would be osteoporosis. A relatively common problem being faced by post-menopausal women especially. Okay, what is the definition? It would be low bone mass or the microarchitectural deterioration of the bone tissue. The bone tissue becomes very thinned out, fragile, and hence more prone to fractures. Okay, high risk would be postmenopausal women in view of estrogen deficiency. Okay, and those at risk of fall should be target for screening. Okay, the gold standard for screening would be the DEXA bone scan using X-ray radiations. Okay, a lot of them actually don't have any symptoms and present for the first time with a hip fracture. So this is what we want to avoid as far as possible, detecting people at an early stage before they actually sustain a hip fracture. Because a lot of people or women who sustain a fracture may not go back to their original condition. They may be having to be dependent on others, requiring special nursing care and so on. Okay. Other symptoms, some may have a hunch posture because of the collapse of the backbone. Okay, some may even experience non-specific back pains. Okay, so this is a table on the incidence of hip fracture in the year 1997. So if you compare male versus female, and as you age, the numbers rise in both genders. Okay, and as you can see, females are actually, the incidence in females are almost the double as compared to males. So what are the risk factors for osteoporosis? Includes female with advancing age, premature menopause, a family history of osteoporosis, previous history of a fragile fracture. Okay. Modifiable risk factors would include diet low in calcium, vitamin D, sedentary lifestyle, uh, stopping prolonged steroid use in patients for other conditions, treating other secondary causes, and even alcohol or smoking. Okay, so how do you prevent osteoporosis? Generally, start exercising at a very young age. Generally, weight-bearing exercise is said to help. Some resistant exercise may help as well. Okay, again, also getting sufficient amount of calcium in your diet or additional supplements, and vitamin D. For those who smoke or alcohol, it's best to avoid them. Okay, so now I'll pass on the floor to Tracy to just give us a brief overview on the dietary recommendations.
Okay, so as a dietitians, we will always aim for high calcium diet or high vitamin D diet for those who have osteoporosis or at risk. So the food sources high in calcium like tofu, tempeh, green leafy vegetable like kailan, or dairy products like milk or even yogurt. So for elderly who are not able to obtain sufficient amount of calcium from diet will definitely need supplements. But remember not to overdose. The recommended intake of calcium is 800 mg to 1000 mg per day. So for your information, vitamin D can help for the calcium absorptions. So the most easiest way to obtain the vitamin D is via sun exposure, or we can get from the diet by taking fortified cereals or oily fish like salmon, tuna, or even mackerel, or something like egg. Okay, so I would like to pass back to Dr. Alishna to continue her presentation.
Thank you, Tracy. So I'll move on to my next topic, prostate cancer, a relatively common cancer faced by males worldwide. Okay, it's a frequently slow-growing disease of elderly men and may not be harmful during his or her lifetime. His lifetime. Okay, risk factors include advancing age, meaning above 50 or 60 years old, a family history of prostate cancer, and those who smoke. Okay, the main screening test used for prostate cancer detection would be a prostate-specific antigen, which is a tumor marker, combined with a digital rectal examination. Okay, who do we screen? Current recommendations is generally to screen those at high risk. Okay, we do not routinely screen all men above 50 years old generally, but again, the decision to screen is up to him after sufficient discussion with his family practitioner. Okay, screening is generally recommended starting from the age of 50 years old with in men with urinary tract symptoms, okay, and earlier in those with a positive family history. Lung cancer would be my final topic for today. So in this diagram, it's looking at the Malaysian National Cancer Registry in the year 2007 to 2011. Okay, and as you can see, most of the lung cancers that were diagnosed were in the stage of 3 and 4. Okay, so our target of screening would be to identify individuals at an earlier stage, hence improving survival. So screening again is not recommended to all. We target it at the high risk groups. So who are the high risk groups? Again, smokers, people beyond the age of 50 or 55, and other additional risk factors, which I will be elaborating in my next slide. Okay, so generally smokers at least or current smoker of 30 pack years or quit in the last 15 years. Both these categories would be candidates for screening. So what are the risk factors? Advancing age, as I mentioned, heavy smoker, a positive family history of lung cancer, previous history of other cancers related to smoking, like bladder cancer. It also predisposes one to a higher risk of lung cancer. Okay, exposure to other environmental carcinogens such as asbestos, silicosis, and also exposure to radon. Okay, the main screening tool for a lung cancer would be a low dose CT lung and not a chest x-ray. So the image here actually shows an appearance of a suspicious cancerous lesion on a CT scan. Okay, in summary, primary prevention is very important. Okay, health promotion, enabling one health education, identifying risk factors at an earlier stage so that relevant preventive measures can be taken before advancement of a disease or before occurrence of a disease. Okay, secondary prevention, as mentioned, would be early diagnosis and prompt treatment. It's always good to treat a disease early, so preventing progression, preventing target organ damage. Okay, so if you prevent progression of a disease, this would enable better quality of life, reducing mortality. Cost of treatment would be also much less compared to treating advanced disease. Thank you.
Thank you, Dr. Alishna, for the informative and interesting talk. So we will move ahead and take some time for the questions. Okay, so the first question is, can a non-smoker develop lung cancer? So I guess quite a number of people wish to know about the answer of this question as well. Dr. Alishna?
Yes, certainly we are. There's a rising number of cases of lung cancer in recent years, even in non-smokers. So other risk factors include exposure to second-hand tobacco smoke. Okay, so it's always important to ask further history on this. Okay, exposure to other environmental carcinogens such as I mentioned asbestos, coal tar, silica, exposure to radon gas. All this would increase one's risk of lung cancer, and it's not just about direct smoking.
Oh, okay. So thank you, Dr. Alishna. Does it mean that actually non-smoker only secure themselves from parts of the risk factor, but they are still exposing to the rest of the risk factor actually?
Yes.
Okay. So now, just a reminder here, if you have any questions to ask Dr. Alishna, please type your questions into the comment box below, and I will randomly choose the questions for Dr. Alishna to answer. Okay, so I will pick some questions from the Google form for Dr. Alishna to answer. So the questions here is, how would you explain a relatively later onset for cardiovascular disease among women in general?
Yes, okay. So women tend to develop cardiovascular disease at a later stage after achieving menopause, about 10 years after menopause, okay, compared to men, which is about 10 to 15 years younger, okay. So this is attributed to the estrogen deficiency that they face after menopause, okay. with estrogen deficiency, it is said that the blood vessels tend to be more stiff, fragile, and hence predisposes them to cardiovascular disease.
Okay. Thank you, Dr. Alishna. So okay, so I repeat the questions here. Is there any specific role for pap smear in women who have never been sexually active?
Okay. For those who've never been sexually active for screening purposes, meaning they have not had any symptoms at all, pap smear is generally not indicated. Okay. However, if they were to be present with other symptoms such as intermenstrual bleed, lower abdominal pain, they would still be, they will then need to be referred to the gynecologist, and at the discretion of the gynecologist, they may still need to undergo this testing.
Okay, thank you, Dr. Alishna. It has really helped us, especially women, to understand more about the pap smear. Okay, so we move on to the next question from the floor. Okay, so is breast cancer inherited? Maybe Dr. Alishna, you can share with us about this, whether breast cancer is inherited from the genetic or maybe is the rest of the risk factors.
Yes, breast cancer is one of the very strong risk factor for breast cancer is genetics or inheritance. So commonest family history of breast cancer. So first degree relative, the more number of relatives affected, it poses even higher risk at particular family member. And also if the younger age of them being affected. Okay. Another form of inheritance would be the BRCA1 and 2, like I mentioned below. Earlier in my slides, those carriers of this mutated form of gene are also at increased risk of breast cancer. So in these people, you may need to start screening instead of 40, even as early as 30 for those gene carriers.
Okay, thank you, Dr. Alishna, for the answer. So we move on to the next question. Okay, so what is prediabetes and its consequences? This one is actually one of the questions from the Google form.
Okay. So pre-diabetes, as the name implies, is actually those people who actually have raised blood sugar levels, but they are not sufficiently high to diagnose them as being diabetic. Okay. The good part about it, if it's a reversible condition. Okay. So with the relevant lifestyle modification, particularly diet, exercise, optimizing body weight, they could actually revert to being non-diabetic, okay, or delay their progression to diabetes, okay. But pre-diabetes also poses a risk of uh, cardiovascular disease and also stroke.
Okay, thank you, Dr. Alishna. So next we will pick another questions from the floor. Okay.
Okay.
Sure. Okay, how frequent should one go for health screening? Okay, so basically everyone don't know or not sure about the frequency of doing health screening. So Dr. Alishna, maybe you can share with us about this.
Okay, so generally the age of starting screening, there's no definitive age. It again goes back to risk factors. Okay, so things like diabetes, high blood pressure is very much rising in trend, and we are seeing more and more of the younger generation actually having these issues. So generally those high risk with a family history, they can even start screening as early as 18 or 21 years old. Okay, so the test done would depend on their condition as well. So generally below 40, screening can be yearly to up to 2 years once, and above 40, screening yearly is generally recommended. So the individual tests like pap smear, mammogram, how often should be done, I think I've elaborated in my slides earlier. So not all tests needs to be done yearly. Okay, some can be done 2 to 3 years once. It also depends on the results of their screening as well. Okay, so if it's high, then your doctor will advise you accordingly.
Okay, thank you, Dr. Alishna. Okay, so due to the time constraint, so we'll move on to the last questions. So what is the role of tumor marker?
Okay, tumor marker is generally not recommended for the screening purposes. So most cases of tumor markers is actually done once the cancer has been diagnosed. It's to assess disease progression, to assess recurrence of a disease or response to treatment. Okay, I know I did mention for prostate cancer screening, we do use, only in that case we do use serum PSA as one of the screening tools. But the other cancers, generally, we do not use tumor markers to screen for them.
All right. So okay. So due to the time constraint, so the rest of the questions, Dr. Alishna will also respond to it later. All right. So finally, we have come to the end of our talk today. I would like to say thank you again to Dr. Alishna for delivering such inspirational talk. And also, finally, thank you everyone for participating in this Facebook Live talk. And hopefully the talk will be beneficial for everyone. So from the presentation just now, we can see that actually the unhealthy eating habit together with sedentary lifestyle are the main contributors for all kinds of the cancers. So please do some dietary and also lifestyle modifications before it's too late. So it's almost come to the end of the year. We do have a few screening packages available. Okay, so such as the cardiac screening package and also Assunta Platinum and Assunta Diamond health screening packages. So if you are interested with any package in that we are on promotion now, please contact the number shown in the slides to book an appointment with our health screening unit. Okay, so thank you for your attention and we hope to see you all again next time.